Okay, so the movement I chose to analyze is a soccer kick. So there's 5 stages of motion you're going to go through whenever you are kicking a soccer ball, and those are the preparation phase, the backswing phase, the leg cocking phase, the acceleration phase, and the follow-through phase. The first stage is preparation. So during the preparation phase of a soccer kick, you want to have your supporting leg firmly on the ground while the toe of your active leg is pointed in the direction you want the soccer ball to go in. So in order to stabilize, you need to have a tight core, and so the main muscles used are the abdominals, the psoas major, the erector spinae, and the spinal postural muscles. For the right hip to extend, the muscles used are the gluteus maximus and the hamstring group. The left hip will use the gluteus medius and minor, the hamstring group and adductor mangus to externally rotate and eccentrically contract. The hamstring group and the popliteus muscles act together in order for the right knee to flex, while the quadriceps will help the left knee with eccentric extension. The right ankle will plantar flex, while the left ankle will practice eccentric extension. The left shoulder will abduct by using the middle and anterior deltoid and the sphenitis. The joints used for the prep phase include the hip, knee, and ankle joints. The action of the hip joints are extension and hyperextension. The knee joints will show flexion, and the ankle joints will plantar flex. This action will take place on the sagittal plane of the transverse axis. The next stage is the backswing phase. So the backswing phase is a moment between toe off until maximum hip extension is achieved. And by toe off, it means when the active leg, your toe is going to leave the ground to come backwards like you're preparing to swing to kick the ball. So obviously for this stage, stabilization is still important because you're really just relying on your one leg that's firm on the ground that's not moving to keep everything stable so your other one can swing. So you're just going to use the same muscles of your trunk that you would in the prep phase to make sure you have a tight core to keep stable and maintain your balance. The right hip will begin to internally rotate and flex by using the tensor fascia lata, the rectus femoris, the psoas, the iliacus sartorius, and the adductor group. The left hip will undergo extension by using the gluteus maximus, the biceps femoris, the semitendinosus, and the semimembranous of the hamstring. Both the right and left knees will extend using the rectus femoris, vastus lateralis, intermedius, and the medialis of the quadriceps. While these muscles are working with the femur, tibia, and fibia, a hinge joint is created at the knee to make it easier to bring your foot back toward the ball when you're ready to kick. The ankle should be plantar flex, abducted, and slightly pronated. The tibialis anterior will undergo an isometric contraction to hold the ankle of your stable leg firmly on the ground. The left shoulder will now horizontally adduct using the anterior deltoid, the biceps brachii, and the pectoralis major. The joints involved will include the ankle, knee, hip, shoulder, and elbow, and this motion occurs on the sagittal plane on the transverse axis. The next stage is the leg cocking phase. So the leg cocking phase is the action of bringing your foot in contact with the ball. So you should start with maximal hip extension until maximal knee flexion occurs. So you want to start with your leg as far back as it'll go until your leg is as stretched out as it'll go, as if you're going to go kick a ball. So during this phase, the thigh is going to rotate clockwise due to the motion provided by the hips externally rotating. The knee extensors will eccentrically contract to slow the rate of knee flexion from your backswing. Then the hip flexors will concentrically contract to make the leg swing in the direction of the ball with maximum knee extension. The muscles used for hip flexion are the psoas, iliacus, rectus femoris, pectineus, sartorius, and the tensor fascia latae. Also during this time, the longus, brevis, mangus, and gracious adductor perform hip abduction to extend and cause the rotation of the hip abduction angle to let the kicking leg move in the correct direction during the swing. So by the end of this phase, like I said earlier, full knee extension should be achieved. Again, the joints involved will include the ankle, knee, hip, shoulder, and elbow, and it's still going to occur in the sagittal plane and cross over the transverse axis. So the next stage is the acceleration phase. So the main goal of the acceleration phase is to gain as much speed as you can from the leg cocking phase before your foot is going to actually come in contact with the ball. So with that being said, the knee flexors will be the prime movers of this phase because most of the power from kicking comes from straightening your knee out. So in order to gain the knee extension you need, the hip flexion will decrease to slow down the knee and thigh until it is time to connect with the ball. The hamstring muscles in the sartorius will then contract concentrically to reduce the knee extension. The last action before the foot actually comes in contact with the ball is when the hamstring will slow down the leg eccentrically by creating a flexor movement at the knee joint while the knee is extending. During acceleration, the tibia and tarsals from your ankle joint need to stay slightly flexed when you kick so you can keep all the power you've gained from coming forward. The phase also occurs in the sagittal plane and on the transverse axis. Stage 5 is the follow-through phase. So the follow-through phase is when the foot finally comes in contact with the ball. So your right hip is going to externally rotate, extend, and abduct, all of which will be an eccentric motion. The muscles used for this are the hamstring group, the gluteus medius, the quadris femoris, and the gluteus maximus. At the same time, the right knee is also going to eccentrically flex by using the hamstring group. Once contact is made, the calcaneus fibular, talofibular, and the tibiofibular ligaments absorb the shock from the contact with the ball, while the Achilles tendon controls the angle of the foot. This motion occurs in the sagittal plane and will cross through the transverse axis. So the major joints used in the action of the soccer kick are the knee extensor, the ankle flexor, and the hip flexor, and each of these joints are used in every phase of the soccer kick.